Thanks for joining me here today, and I hope that you've been enjoying the last couple of weeks with our guest interviews on Conversations with Cabral. Today, I would love to be able to introduce Patrick McKeown, and he is the author of The Oxygen Advantage and someone who is looked at as the expert in how to properly breathe. Now, when you say that, you might say, well, I already know how to breathe. I breathe all the time and mainly involuntarily. Well, here's the thing. The way that you breathe actually dramatically changes so many things in your life. Let me just give you an example. Your face shape, believe it or not, is partially formed based on the way that you're breathing as a child. We go over oxygenation. How much oxygen do you get in through your mouth versus through your nose? Should you be mouth breathing and nasal breathing at the same time? Just nasal breathing? Should you be breathing in through your mouth, out through your nose? We go through all of those topics today. Or I should say, Patrick McKeown is one of, like I said, the foremost experts in this space and has been now for a couple of decades. So when you want to learn about diaphragmatic breathing, when you want to learn about mouth taping or nasal breathing or any of these things, he is the go-to person. So I am excited to be able to bring him on the show. I read his book multiple years ago, many years ago now, and I've really been looking forward to this day. So we were able to connect. He's over there in Ireland, and by the power of the internet, we were able to connect and record, hopefully, a nice conversation for you. Enjoy the show. Let me know what you thought. Take care.
Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
All right, Patrick, welcome to the Cabral Concept. Great to have you on here today. We share many mutual colleagues and friends, and a podcast that I just released not too long ago was with Dr. Jay Wiles, who I'm doing some heart rate variability-based training with, and I know that he's worked with you, and he said, you have to get Patrick on the show. He's going to teach you a more in-depth style of breathing. And so I can't wait to be able to share your knowledge with the world, something that you've been on a mission for quite some time. And I always like to let people know who the podcast is right for. So for me, it's one of those things where I kind of joke around, well, if you are a breathing human being, you need to learn how to do it better, or it's going to affect every other part of your life because it will actually increase the stress response on your body. So Patrick, welcome to the show. Would love to hear a little bit more about you, and then we're going to start to get into how did you get into this field in the first place?
Thanks very much, Dr. Cabral. My background is I live in the west coast of Ireland. I've done so for almost 25 years or so. And I came across breathing primarily as having health issues. I had severe asthma. And with that also, I was exhausted in school. And if you have severe asthma, or if you have, well, it was moderate severe asthma, but I had a number of hospitalizations. I would have been on bouts of oral steroids from time to time. And if you have inflammation of your lungs that travels up to your nose, and when your breathing is faster and harder, as typically it can be when you have a respiratory condition, it impacts your sleep. So I did have obstructive sleep apnea, even though it wasn't diagnosed, but I was told that I was stopping breathing during sleep, and hence then exhaustion in school. And, I suppose you learn to live with your pre-existing conditions. You get on with life. That's the way it is. And then I read a newspaper article, and it was about a Russian doctor who said two things. He said, breathe through your nose, and he said, breathe light. And I started practicing the nose unblocking exercise by simply holding the breath and slowing down my breathing. And that's where the journey began. And then I trained in Russia, and I've been training and teaching full-time since 2002.
And you were able to heal your own asthma, sleep apnea through this specific breathing that we're going to talk about today.
Yes, it completely changed my life. I'm not going to say that this is a cure for asthma. I'm not going to say it's a cure for sleep apnea, but it can make a significant reduction. And we're starting to see it now, 20 clinical trials onwards with asthma, 2 for the eustachian tube. But nasal breathing during sleep is starting to get more attention based on the founding father of obstructive sleep apnea, a doctor called Dr. Christian Guilleminault, who coined the phrase obstructive sleep apnea. And he has been talking about the critical importance of restoring nasal breathing during sleep. Unless you have your mouth closed during sleep, you're not going to have a good night's sleep.
Yeah, I agree. And I've long studied Dr. Weston Price and indigenous people all over the world. And basically, when he said when processed food was introduced to the diet, the face actually became elongated, the nose became elongated, the nostrils became more narrow. But, when I started to read more about nasal-based breathing and Buteyko breathing, please correct me if I'm mispronouncing that, I began to realize that the issue for sure is processed food. That's a big part of it, in food sensitivities. But what it does is it creates inflammation, and then it can actually block the nasal passages, forcing you then to mouth breathe. Because I have a deviated septum, I've been mouth breathing till I was in my early 30s. I didn't know. I just figured you breathe through your mouth, right? I'm getting oxygen in, no big deal. But I certainly have an elongated face. I have very narrow nasal passages. And until I was about mid-20s, if you asked me to breathe through my nose, I wouldn't have been able to do it anyways, because I had all sorts of food sensitivities and I had massive unchecked inflammation in my body from environmental allergies as well as food-based ones. So I cleared that up, cleaned up that, fixed my gut, candida overgrowth, SIBO, H. pylori, you name it. And now all of a sudden I can breathe, but it was weird because it actually almost burned my nasal passages breathing in through them because they were not used to getting oxygen in, especially during sports. So I then said, there's something to this. And I began to read research such as your own, and also different types of nasal-based breathing, Ayurvedic nasal breathing, certain types of internal martial arts-based nasal breathing. And they were really all saying the same thing, which you just mentioned, which is slow, gentle, and it's almost like you're not breathing at all. So there's very little effort, and it's also controlled. It's almost this rhythmic flow through your body rather than you have to actually forcing yourself to practice. Okay, breathe in, stop, hold, breathe out, pause. And so I think that's what we need to get to. But what I'd love to do today is to talk about how do we progress? How do we get there? Because it's not as simple as just saying, okay, well, actually, you have a great book that says close your mouth. But the book that got deeper into it was The Oxygen Advantage. So I actually read The Oxygen Advantage first, I would say early 2017. And then I read the previous book, which is more like a handbook on close your mouth. And that was enough for, I think, most people to kind of get into it, because you want to start to experiment with it and I think start to learn a bit more. So I would love to get a little bit more into this, talking about Buteyko breathing, how it was developed from Dr. Buteyko. And just to let people know, this is grounded in science. I mean, clinical research showing a 70% reduction of nasal symptoms in participants that dealt with snoring, loss of smell, nasal congestion, difficulty breathing through the nose, and I would put sleep apnea in there as well. So, I mean, this is the real deal. If you have difficulty with asthma, and I would even say allergies as well, this is a big part to being able to help to rebalance the body.
Yeah, like Dr. Buteyko, when he made his discovery back in 1957, the available research at the time was based primarily on carbon dioxide. And when we look at it now, there's more at play. Because, for example, if you consider the gas nitric oxide first discovered in the human breath, the exhale breath in 1991, and that plays a considerable role in respiratory health. If you look at the connection between the nose and greater amplitude of the diaphragm, that if we have our mouth open, we typically breathe fast in upper chest breathing. But we also know since 1988 that individuals who are forced to breathe continuously through their nose, that the PO2 of their blood increased by 10%. So, it's not just about carbon dioxide, but the exercises that Dr. Buteyko developed, absolutely to this day, have remained unchanged. And they're very, very good in terms of approaching the biochemistry of breathing. And when we talk about breathing, we need to talk about breathing from breathing light, as you say, almost imperceptible, because you can influence your blood circulation and oxygen delivery by breathing light and breathing less air. It's often ironic that how we are trained or taught, or what we hear in the Western world is breathe hard, breathe more air, take fuller breaths. People go into different studios, they're doing breathing exercises, you hear them breathe. It doesn't make sense to hear people breathe during rest, because if you're hearing your breathing, it's likely that you were breathing too much air. And breathing too much air is getting rid of too much carbon dioxide from the blood through the lungs. And the loss of carbon dioxide is going to cause blood vessels to constrict and less oxygen to be delivered throughout the body. And that's why we feel lightheaded when we breathe too hard, too fast. Now, how about a person who is habitually breathing that way all day long? They are stuck and more likely to be fight or flight. Their sleep is affected, but their emotions are affected. And if we look at the research by Stanford Medical School in March of 2017, when they identified a new structure in the brain that is literally spying on your breathing, and this structure is conveying signals to the rest of the brain. If we breathe fast, this structure is relaying signals of agitation to the rest of the brain, but is also more likely to wake us from sleep. So mouth breathing, we don't get that deep quality of sleep that we should be. So even just breathing through the mouth, not only is it increasing the risk of snoring and obstructive sleep apnea, it's also more likely to arouse us from sleep. And a paper published in 2017 by the American Thoracic Society looked at 5,000 individuals, and the greatest risk of mortality in this group of individuals with obstructive sleep apnea was not the individual who was stopping breathing for a minute and a half, but the person with mild to moderate sleep apnea who had continuous sleep fragmentation. Now, I think there's so many things to this, and like Dr. Weston Price's book is Super Nutrition and Physical Degeneration. I think one aspect of it is chewing, that if we chew hard foods, it develops the muscles of the jaws and it helps to maintain good muscle tone for adequate nasal breathing. Another thing is breastfeeding. And this is not against any mother who, because of having to go back to work and society, the pressure that society is putting on young couples with mortgages. But breastfeeding is not just about nutrition. Breastfeeding is about the manipulation of the muscles necessary for craniofacial growth. Now, genetics can play a role as well in terms of you could have a child who is born with a narrow palate, but that may be influenced by the nutrition of the mother. So if we look at our ancestors, we typically see wide facial structures with forward growth of the jaws. And this is not up until that long ago. I will give you a story. I was in Lithuania at a dentist's office, and she's a professor of dentistry at the local university. And during the revolution back in 1917 or thereabouts, a group of individuals rebelled against the Russians, and they were caught. The Russians hanged them, threw their bodies into an unmarked grave. And about a year ago, the graves were found, and she was commissioned with the task of identifying these bodies. We looked at the skulls. The skulls had perfect forward growth of the jaws, plenty of room behind the teeth. So there was plenty of room for the tongue. And we need to have adequate room in the mouth for the tongue, because the tongue is either going to be in two places. It's either in the roof of the mouth or it's falling into the throat. And if it's falling into the throat, it's causing increased resistance to breathing, and it's compromising our breathing during sleep. So I think there's so many different facets to it. And, whether you look at the connection between nose breathing and diaphragmatic breathing, nose breathing during wakefulness slows down the breath. This allows more oxygen to transfer from the lungs into the blood. Nasal breathing, harnessing nasal nitric oxide, which is antiviral and antibacterial, and especially with COVID. And the other aspect is efficiency of breathing, that if we are breathing fast and shallow, we are wasting so much air in dead space. So to improve alveolar ventilation, we are much better off breathing slow and low. So in a nutshell, it's all tied in together. We can't just focus on, say, the biochemistry of breathing, which is breathing light, but we also need to consider the biomechanics of breathing, which is using the diaphragm. And we also need to consider practicing coherent breathing or cadence breathing to stimulate the vagus nerve, to increase the sensitivity of the baroreceptors, to improve heart rate variability, to influence the autonomic nervous system. So, but ultimately, it is about nose. And usually I say to people, it's light, slow, and deep breathing. The acronym is LSD. And of course, any of people that 1990s generation, they'll probably remember that firsthand. Light is about breathing a volume of air that's normal, not fast upper chest hard breathing, not doing yoga with hard heavy breathing, but doing yoga with light breathing. And what's more important, it's not how we breathe during the practice of the exercises, it's how we breathe outside of the exercises. It's our everyday breathing.
Yeah, that's great. And I want to actually get back to that because I practice biofeedback myself 3 times a day just for 3 minutes. But the goal is not those 3 minutes to see, oh, can I double my heart rate variability? It's actually, am I able to take that with me for the next 20 minutes, 30 minutes or longer? Because the goal is to, and I was talking about this with Dr. Wiles, is I want to be able to set my thermostat a little higher in terms of heart rate variability. And I know that I can set it higher while I'm practicing, but can I take that practice of, let's say, meditation out? So meditation is a nice technique, but there should be this state of meditation that you take with you then for the rest of the day. And I don't want to glaze over this point because what happens is that your physiology affects your psychology. So as you just said, if there is inflammation of the body, if there is allergies, if your breathing is off and you have an apnea or you do wake up throughout the night, well, you're going to be more fatigued the next day. And that's going to make you a little bit more tired, a little bit more irritable, whatever it might be. You're going to be more stressed out. It's going to get you more in the sympathetic nervous system. You're going to get even more into your chest breathing or holding your breath. And then it's going to keep this cycle going. So I always tell people, if there's only one thing that you can do while stressed, it's go back to your breath. That's it. Like, don't think about your problems. Just go back to your breath, because a lot of people freeze up, more like the polyvagal nerve-based theory, and they're just stuck, or they get into rapid, shallow breathing. And then maybe they have the light breathing down pat, but it's rapid. And they're not actually allowing maybe that carbon dioxide to build up a little bit in the blood, and their breath rate is simply too fast. So I'd love to hear you kind of expound a little bit more on the physiology affecting the psychology, because so many people believe that they are not able to control their anxiety, their overwhelm, their irritability, where I would actually say there's very few people that if they did biofeedback and breathing for 3 minutes, they wouldn't feel a whole lot better. And for the most part, I'm not saying this is a cure for anxiety, they'd be able to lessen that to a great degree.
I totally agree on what you say. And it's funny, I'm just going to put a slide up if I can do it. Oh, well, I can't do a share screen as I'm not the host. But it's showing the interconnectedness between breathing, the emotions, and sleep. And here's the aspect about dysfunctional breathing patterns. And dysfunctional breathing patterns is basically if there's any impairment to breathing, if breathing is faster, if it's upper chest, if it's irregular, if there's no natural pause after exhalation, if breathing is an effort, or if it's mouth breathing, that those are typically the trait. And most often they're overlooked. However, the normal population, about 10%, are documented to have dysfunctional breathing. In asthma, it's about 30%, but the anxiety population, it's 80%. Now, 80% of the anxiety population with dysfunctional breathing. And then I have people coming into me with depression, and we speak about how do you feel when you wake up in the morning? And they often wake up and they're feeling exhausted. And then I ask, well, has anybody ever helped you or assisted with looking at your quality of sleep? And more often than not, it's no. We cannot overlook the bidirectional relationship between breathing, the emotions, and sleep. If we are breathing fast and shallow, we are more likely to be in that fight or flight, that sympathetic activation. And if we are in that more stressed state, that in turn is impacting our breathing. So it's not just that stress is changing our breathing patterns, but if we have an everyday breathing pattern which is fast and shallow and mouth, it's feeding into stress. Now, when our mind is agitated, it's difficult to fall asleep. We are more likely to have insomnia because the mind is agitated. There's a lot of thought activity going through the mind. We cannot switch off and we cannot fall asleep so readily. But also, if we are breathing hard, we are more likely to have sleep apnea, snoring. So therefore, our quality of sleep is reduced. We are waking up tired. That's feeding into the emotions. And it's almost that it's three legs of a stool. Breathing, the emotions, and sleep absolutely go together. And one way that we have under our control to influence this is by breathing, by focusing on the breath. And what I would say to your listeners is, did you know that you can influence your blood circulation by simply learning to breathe a little bit less? And I'm not talking that this is the way you should breathe all day long, but what I am saying is just practice this for periods of time throughout the day. On a very simple level, people who have dysfunctional breathing very commonly have cold hands and cold feet. And they don't just have cold hands and cold feet, but they can have brain fog. So if they were to practice sitting down, focusing on the airflow coming into their nose, focusing on the airflow as it's leaving the nose, and gently slowing down the speed of their breathing so that they're taking a very soft and slow, gentle breath in through their nose, almost as if they are hardly breathing. And at the top of the breath, to bring a total feeling of relaxation to the body and having a prolonged and relaxed exhalation. And then on the next breath, they're taking a very soft and slow, gentle breath in. At the top of the breath, a total feeling of relaxation to the body and a relaxed, gentle breath out. The objective is to breathe about 30% less air into the lungs, not by holding the breath, not by freezing breathing, gently slowing it down. You are doing it correctly when you feel air hunger, and air hunger signifies that carbon dioxide is increased a little in the blood. And carbon dioxide is not just that waste gas. We need a certain quotient of carbon dioxide, and that will play a role in opening up your blood vessels. You will notice your hands getting warmer. You will also notice that you start to feel drowsy. And you will also notice in general that you've got increased watery saliva in the mouth. In other words, it's teaching you how to downregulate. It's teaching you how to bring the body into relaxation response. So we focus on the biochemistry, and then we focus on the biomechanics, and that's simply having hands either side of the lower two ribs. And as you breathe in, that your ribs are gently moving out, and as you breathe out, that the ribs are gently moving in. And we have individuals to bring their breathing from the upper chest, which is totally inefficient, totally uneconomical, and it doesn't even make sense during physical exercise. You know, I know you spoke about physical exercise with the mouth open. Mouth breathing is absolute trauma to the upper airways. If we look at the physiology of the mouth, and here I use my anatomical model, when you look at the anatomy of the airway, the upper airway, you see the nose here and you see the lips. The mouth performs no function whatsoever in terms of breathing. Air comes in through the mouth and it goes straight down the throat. So there are zero functions performed by the mouth in terms of breathing. Our nose is occupying so much space in the skull. And back in the 1970s, Dr. Morris Cottle, he was an ear, nose, and throat doctor. And he spoke about the human nose performing 30 functions in the human body. So again, it's coming back to the nose and coming back then with slow breathing using the diaphragm. And then we bring in, you're breathing in 2, 3, 4, 5, reducing the rate to a cadence of approximately 6 breaths per minute to help influence the autonomic nervous system. I think one of the most wonderful things that we can have, Dr. Cabral, is to take our attention out of the mind onto the breath. And I think there is no better time to do this. And the reason being is because everything is capturing and taking our attention. We are surrendering our attention to everything outside of the body all day long. Social media, phones, advertising, radio, TV, information. We are literally, everything is, all of our attention is going outwards. And one of the best things that we could ever do for focus, for concentration, for sustained attention is to bring our attention inwards. Because when the mind is agitated, when there's a lot of thoughts going through the mind, when the human being is under stress, long term, it is not good. Many conditions, as you will know, are, the precursor to that can be chronic stress. The human body is not able for long-term stress. But even on an everyday level, our ability to concentrate is our ability to hold our attention on a subject matter for a period of time without distraction. This is when we can fix our attention with sustained attention, that we have 100% of our capacity to hold our attention on the subject matter, not being distracted by random and incessant and repetitive and critical thinking. But training the brain is very important, and we can do that through the breath. But ironically, the people who would get the most out of mindfulness will have the most challenging to it. And oftentimes I say that mindfulness doesn't suit the very group that it's aimed at. People with anxiety, people with panic disorder, people with depression. How can you focus on your breathing when the mind is in an emotional turmoil? And here is where we need to bring in different strategies. Small breath hold exercises, box breathing, small pace exercises. There's many different exercises that we can use to increase blood flow to the brain, relaxation, and those strategies with heart rate variability. So I think in terms of it's immense, but I really feel it's unfortunate that breathing has been relatively overlooked, with the exception of functional medicine, that in mainstream, the person who's going in with depression doesn't be trained in terms of functional breathing. Their sleep is not being looked at. Sleep doctors, with the exception of Dr. Christian Guilleminault and Stanford Medical School, have been pioneering the importance of nasal breathing. And they would be a leading center in the world in terms of sleep medicine and talking about restoring nasal breathing during sleep. And I remember being at some conferences. I spoke alongside Dr. Christian Guilleminault through the AAMS, which is an organization in the United States under Mark Moeller. And I remember doctor after doctor talking about sleep. And he stood up in the crowd, and he passed on about 8 months ago, unfortunately. He stood up in the crowd and he said to his colleagues, he said, "Doctors, you have been talking about everything in sleep except the elephant in the room. The elephant in the room is nasal breathing." That's how much attention he put on it. And that's what we need. And I say to people, if you wake up with a dry mouth, you're not likely to have a good night's sleep.
Yeah, I agree. And with biofeedback today, we're able to actually look at our level of REM and our level of deep sleep, just two components of overall sleep, not just the length of time. But what I found is that, for me, I get about 7.5 to 8 hours of sleep per night. That's kind of the spot that my body needs. And most people need between 7 and 9 hours per night. There's actually detrimental results on the body in the long term. You can get away with anything in the short term, depending on the level of hermetic stress in your body, what you're able to handle. But in the long term, people that slept over 9 hours consistently or less than 7 were more likely to die of all factors. But it goes well beyond that, because some people don't feel rested at 9 hours. And how can you not feel rested at 9 hours? Well, if your deep sleep is less than an hour and a half and your REM is less than 2 hours, you can get all the sleep in the world, but you wake up never feeling rested. And that's the issue with a lot of these sleep medications out there. Sure, it'll put you to sleep in a lighter sleep, but you never get into that deep restorative sleep. And as you just said, mouth breathing could increase apneas or vice versa. But at the same time, mouth breathing will not allow you to stay in a sustained level of deep sleep for any certain period of time for most people. Again, some people, yeah, that's what their body has gotten used to. However, their respiratory rate, which is a little bit different than breath rate, will be different. So I agree with you about, 6 breaths per minute. I think you had it right. That's 10 seconds or so, maybe even less for some people if you're trained. But the respiratory rate, that varies, because in medicine, they're like, well, anything between 12 and 18 is okay. But I would actually say once you're creeping up above 14, 15, maybe your body's not in the best space possible. So if you're using a biofeedback-based device like an Oura Ring, something like that, and your breath rate is above a 14 or 15, start to think about it. Are you mouth breathing more than you should? What are your thoughts on that?
I totally agree with you. And it's all changed. 20 years ago when I was looking at respiratory rate in detail, typically it was recommended that people should be breathing 12 to 14 breaths per minute. And now we are seeing that it's recommended that people should be breathing between 12 or between 14 and 16 breaths per minute. 16 breaths per minute is too high. Mm-hmm. It's too fast and it's too hard. And, that is the toll that's putting on the human body in terms of the 3 main functions. Like if we're looking at sleep, arousal threshold, the propensity to wake from sleep, just as you said, which we said already that one study showed, it was a longitudinal study with a large population of people. It was the greatest risk of overall mortality. Faster breathing is likely to waken us from sleep. And the whole field of sleep medicine has changed dramatically in the last few years. Originally, obstructive sleep apnea, and if I give you some stats on the incidence of it, a Swiss study looking at individuals between 30 and 49 years of age, with men, it affects 26% and with females, it's 9%. However, when men go through, when they're between 50 and 70 years of age, it's 43%, almost 1 in 2. But with females, when they go through menopause, postmenopausal, it increases 300% and it increases to 27%. Traditionally, obstructive sleep apnea was seen as an anatomical issue. In the last 5 years, there is a recognition that there are 3 non-anatomical traits. And those 3 non-anatomical traits, one refers to as loop gain, the other is upper airway recruitment, and the other is arousal threshold. But breathing plays a role in all 4. In terms of the anatomy, if you have your mouth closed with your tongue resting on the roof of the mouth, breathing in and out through your nose, your airway is wider. The diameter is wider, less likely to collapse. Number 2, if you have good functional breathing, as evident with a Bolt score above 25 seconds, and that has been tested. Professor of Physical Therapy, Dr. Kiesel from Evansville University, I think it's in Colorado, he looked at 51 subjects, 27 years of age, healthy individuals. He concluded that from the study of these individuals, that their breath hold time, if it's above 25 seconds, there is an 89% chance that dysfunctional breathing is not present. If I look at the paper by Dr. Messino from Harvard, he measured loop gain in obstructive sleep apnea using breath hold time. Because if people have a low breath hold time, 10 seconds, 15 seconds of a Bolt score, they typically breathe faster in upper chest breathing, and faster in upper chest breathing increases resistance in obstructive sleep apnea. But here's the interesting thing about the nose and the diaphragm. When we breathe through the nose and we get a greater amplitude of the diaphragm, it increases lung volume, and the throat is stiffer and less likely to collapse. So the muscles in the throat that are designed to help maintain an open airway, they work better. Now, obstructive sleep apnea is one of those conditions that is now getting attention. Maybe 15 years ago it wasn't. And if you're talking about weight gain, you're talking about the influence on leptin and ghrelin, diabetes, cardiovascular health, fibromyalgia, Alzheimer's, stroke. All of these things can be related to obstructive sleep apnea. And mouth breathing is a real, factor in that. And to give you a stat on that, men or individuals over 40 years of age, they are 6 times more likely to spend at least 50% of their sleep time breathing through an open mouth. So it is something that happens as we get older.
I believe that. I want to qualify the breath hold time because I want to make sure that I'm correct as well. Breath hold time in this specific scenario would be breathing normally and then exhaling fully and then holding your breath. Is that correct? You don't want to take a breath in and then hold.
No, it's always an exhalation because we want to get a consistent measure amongst a group of individuals. And if we said to people to breathe in and hold, everybody will have a different lung capacity.
Yes.
So it's pretty much, you're sitting down for about 5 minutes, you take a normal breath in through your nose, a normal breath out through your nose, and you pinch your nose with your fingers, and you're timing it in seconds until you feel the first definite desire to breathe or the first involuntary movement of the breathing muscles. And then you take a breath in. And some people will be shocked, because it is influenced by genetics. It is influenced by asthma. For example, if there's any kind of bronchoconstriction in the lungs, it reduces breath hold time. Anxiety can influence it. Panic disorder can influence it. And also, it is typically seen as a measure of the chemosensitivity of the body to carbon dioxide. But in general, aside from that, as a breath hold time, it's a good indicator of functional breathing patterns.
One interesting thing working with Dr. Jay Wild as well is that I'm always trying to increase the availability of oxygen to my tissues. So a lot of people look at tissue oxygen availability a little bit differently. So everybody looks at the blood and they say, well, there's no such thing as acid and alkaline because your blood maintains a certain pH of about 7.356. And I would say, I agree. But if you study bioregulatory medicine and look into the biochemistry of the tissues of the body, the tissues and cells can actually be more acid or more alkaline. And for me, and I believe there's a correlation, as you said, with genetics as well, So more of the Vata-based body type in Ayurveda or the ectomorph, they're going to be naturally a little bit more prone to sympathetic nervous system dominance. They're a little bit more wired in that way of the nervous system. We see thinner joints. We see a little bit more anxiety in that specific type. And what I've noticed is that the oxygen availability seems to be less. There's more of that chemosensitivity to CO2, meaning that even for myself, for example, so we haven't spoken really before. So my background is I had Addison's disease, I had fibromyalgia, POTS, all sorts of immunodysfunction when I was 17 years old. It wasn't diagnosed till about 2 years later. So basically living 2 years with just a miserable, miserable life, we'll put it that way. That's how I got into this field, of course, is that the best, most brilliant doctors in the world, as I always say, couldn't put me back together. And so I began to learn that there's more to this. Well, now, I mean, I feel better today, 20 plus years later, than I ever have in my entire life. And every year I feel that much better. But there hasn't been a lot for me to say, oh, I need to work on this. So I've been looking at telomeres and working my telomere length and all those different things. But what I found with working with Dr. J is that I'm fine with the breath hold rate. So basically, no problem at all. Exhale, I can hold well over 25 seconds. However, when you add any physical activity to that, it plummets. So, and this is just, I've just realized in really the last couple of weeks because I didn't even know that it existed. And that's why I love being able to talk with experts like yourself. So for me, and I believe you learned this from you, is that all I did was exhale, but now I just took normal paces, normal walking. And I couldn't make it really more than about 15 steps before I felt that air hunger right away. I said, I need to breathe. And so that taught me right away that, okay, I need to work on the availability of oxygen to those tissues. And so now I look forward to the challenge of actually being able to improve that with a lot of what you're speaking about today. I've done box breathing. It's tremendous for helping me to fall asleep within minutes. I used to be a complete insomniac, partially probably because I was in that sympathetic nervous system state, which led to the Addison's disease as well. So I'd love to hear kind of your take on that and improving oxygen availability to the tissues themselves, not just in the bloodstream.
Yeah, of course. Like if you go back to 1904 and we look at the Bohr effect, BOHR, and it was developed or, discovered by a Danish physiologist called Christian Bohr. Basically, he said that the carbon dioxide pressure in the blood is a catalyst for the release of oxygen from the red blood cells to the tissues. If we measure pulse oximetry, and that's, people are aware of it now with COVID, little finger held device that you put on your fingertips, and it's measuring the fraction of your hemoglobin occupied by oxygen. And that's all very well. And, people coming in with fibromyalgia, with people with high stress, with chronic fatigue, they typically will show normal blood oxygen saturation. But if they go for a walk, if somebody with chronic fatigue syndrome goes for a walk, they might have to go back to bed for 2 hours because of the increase of lactic acid. The question we have to ask is, why? If there is insufficient oxygen delivery from the blood to the tissues, the hydrogen ion coming from the tissues doesn't get oxidized, to form water. And when there's sufficient oxygen getting to the tissues, the hydrogen ion does get oxidized to form water. When there's insufficient oxygen getting to the tissues, the hydrogen ion doesn't get oxidized, and it associates with pyruvic acid to form lactic acid, and that in turn then dissociates into hydrogen ion and lactate. So it's not just about the oxygen in the blood, but it's about getting the oxygen from the blood to the tissues. And that is based on carbon dioxide. Now, when we're working with chronic fatigue syndrome, I go very, very gently because I've made the mistake in the past. Energy levels of these individuals can be very low. And me and my enthusiasm 10 years ago, I used to floor people because I would give them exercises that the dose and duration was too strong, and I didn't realize that their energy levels were depleted. But now what we do is we give them very gentle dose of the breathing exercises as a stressor, as a little bit of a stressor. And we're using the breathing exercises to stress the body to make adaptations. Now, part of what could be happening there is that we are increasing the buffering capacity inside in the muscle compartment to delay the release of hydrogen ion as well. So not only are we improving breathing by assisting with more normal breathing volume and increased oxygen delivery to the tissues, but also to increase the buffering inside in the muscle compartment. And I think it's an interesting one because our life now very much is comfort-based. And, throughout our evolution, we were always prone to short-term stresses to force the body to make adaptations. But through the breath, we can do that. Now, as I said, we have some exercises where we deliberately stop breathing and do breath holds to lower blood oxygen saturation down into the mid-80s or even into the 70s. We don't go below 70% typically because there's a risk of passing out, but we don't hyperventilate before the breath hold, so therefore the risk is minimal. And we use it more so with athletes and performance individuals to force the body to make adaptations to stimulate anaerobic glycolysis. But for people with chronic fatigue, we would start off with very gentle exercises, build them up, and over a period of weeks, we would start giving them breath holds to disrupt homeostasis to get some change happening there. So I think it's an interesting concept, and I would go back to it. Many individuals who are not well, they have plenty of oxygen in their blood. The issue is not that there's not enough oxygen in the blood, but that the oxygen is not getting from the blood to the tissues. There's no point in breathing for that oxygen to do a round trip that we breathe it back out again. And that's where breathing volume is important. So if somebody is breathing harder, breathing that little bit faster, taking more air than what they need to cause a lowering of carbon dioxide, less oxygen gets delivered.
Yeah, I completely agree. And that's a big thing is what we do as well. We just, as you would say, call it a hermetic stressor. And breathing can be a hermetic stressor for someone with chronic fatigue or Addison's disease. I mean, for me, my sensitivity to stress back then was very, very small. So I give the analogy before where I would play a 20-minute pickup game of basketball with my friends in college, and I would have flu-like symptoms and bronchitis for the next 2 weeks. I mean, and then it would just repeat itself essentially all winter long. And that cold air, especially in New England, is not great when you're dealing with breathing dysfunction as well.
Yes.
So, and mouth breathing. So, because that's not how it's meant to be taken in. It can't actually go through those turbines in the nostrils to meet the proper temperature as it goes in the lungs as well. So one thing we do is with a graduated exercise program too, we're working on walking and breathing. So walking, unlike a hard exercise, will induce parasympathetic nervous system activity as long as you're not checking your email or doing anything like that, and focused on your breath, right? Going
Sure.
back to your breath, walking, and then it's cardio, believe it or not. It's just static state and cardio. And then we'll work up to more of the anaerobic-based exercise, which actually, just like you said, builds up more lactic acid. And if you're not able to buffer pyruvate and pyruvic acid and lactic acid, and that cycle is not working specifically with you, well, that actually takes clearance, and that's a much greater stressor on the body, and it is acidic, and so the pH level of the tissues actually goes down too, and you are more prone to getting sick. So I really like this, working with the breath. One thing I started to do a couple of years back was actually practice when I did my aerobic-based cardio, keeping my mouth closed, and that was very challenging because I had to slow my pace way down. But I said, can I run or can I jog keeping my mouth closed? And if so, for how long? And I would continue to try to push myself. And then there seems to be an upper limit. When you start to push a little past aerobic into anaerobic, then it seems very difficult to keep the mouth closed the whole time. But correct me if I'm wrong. I think there's a time and place where you need to open up the mouth when you're doing certain types of anaerobic-based sprinting.
Yeah, I would agree. The ability to run with mouth closed or ability to do physical exercise with mouth closed is very much influenced as well by nasal cavity. Mm-hmm. And you see my nose as well as a mouth breather. Yours is narrow as well. And 60% of the Western population have a deviated septum. And a deviated septum can also be contributed to by mouth breathing during childhood. And this is where the cartilage, the bone dividing one side of the nose to the other is crooked. So it can help when individuals have a deviated septum to use what's called the Cottle maneuver or use a nasal dilator. Mm-hmm. And that's based on simply having your hands either side of your nose and just gently prising them apart. And that just helps to reduce the resistance to breathing. Now, if you look at some individuals with good facial structure, and race can play a role here as well. So European or Caucasian typically will have smaller noses and a greater resistance to breathing. So as a result, the few things that will influence your ability to run with your mouth closed, number one is Bolt score, because the lower your Bolt score, the harder the individual breathes. Number 2 is the size of the nose, the entry of the air into the body through the nose. Number 3 is how long has the individual been doing physical exercise with their mouth closed? So at the start, it's pretty tough. The air hunger is suffocating. That's why it's better to go a bit slower. But after about 6 to 8 weeks, adaptations take place and the air hunger diminishes. But there was a paper published by Dr. John Dulliard and Travis back in 1991, and they looked at flow states with athletes who were nasal breathing. They achieved flow state in comparison to mouth breathing, which is that fight or flight. So I would say to people, and if we look at George Dallam, who is a professor of medicine, sports medicine in the United States, he did a recent study which was published back in 2018. He got 10 recreational athletes to consistently breathe through their nose for a period of 6 months. And then he said, let's measure their physical performance. There's no point in just rounding up 10 athletes who have been mouth breathing for the past 20 years and say to them, right, guys, now we're going to get you nasal breathing and we're going to test you. Of course, the results are going to be on the floor because you're introducing something so new and so alien to those group of individuals. Their performance is going to slump. But Dallam, what he said, let's get this group of individuals and have them nasal breathe during all of their physical exercise for the next 6 months, then measure them. At 6 months, they had 22% less ventilation for the same 100% work rate intensity, 22% less ventilation. Now, that's a huge saving economically. In terms of, because there's an energy expended by the body in terms of breathing. As we sit here, 2 to 3% of our oxygen consumption is going to support the breathing muscles. If we go for a walk, it's probably about 4 or 5%. If you go for a run, it's about 10%. If you do maximum intensity exercise, it's about 15%. However, if you're chronically hyperventilating or if you're breathing really, really hard, it can be as high as 30%. So you can imagine somebody with dysfunctional breathing, they're wasting more air, oxygen unnecessarily to support their breathing muscles, and their breathing muscles are also more prone to fatigue. So we need to improve breathing efficiency. And what I would say to people is, yes, nose breathing at the start is difficult, but stick with it.
Yeah, one thing too is it's not, and I completely agree, and I know that you feel this way as well, but it's not just a strain on the musculature when you're doing even hard exercise and breathe through the mouth. It's the often overlooked central nervous system. So you have the peripheral nervous system, the central nervous system. And oftentimes when we're dealing with real chronic fatigue, the muscles are fine. They really are. The issue is that the nervous system is essentially short circuit. So everything, it's just hot wired at that point. It's sympathetic nervous system dominance. And then after a while, the body says, we can't support any other stress. And then we go into that polyvagal based response. And now we're in a really stuck state. So I would say that for me, breathing is going to improve performance. It's going to improve energy. It's going to improve brain fog. It's going to improve circulation. And then in turn, though, it's going to help calm the nervous system. And then the nervous system is going to help improve the endocrine system, your hormones. So that's when it starts to be a game changer, because if you can improve your DHEA as you age, if you can improve your estrogen progesterone balance and your overall cortisol, which affects thyroid, well, I mean, that is literally part of the fountain of youth. And you do that through the nervous system, and you stimulate the nervous system through shallow breathing, sympathetic nervous system, or through that, what you said, the light, slow, deep breathing and that stimulates the parasympathetic nervous system. So it really does come back to the breath. I mean, Ayurvedic medicine, traditional Chinese medicine, or Tai Chi, those forms of it always said that breath is fundamental, and that beyond food, beyond sunlight, you have to go back to your breathing. And so I know it seems almost too simple. People are like, oh, there has to be something more to it than this. And there is. We're teaching it right now, which is nasal-based breathing and a specific rhythm and flow. I always tell people, if you're going to err on the side of breathing out or exhaling longer than you breathe in, so you're not stimulating that vagal nerve, right? I would love a couple more tips on that. And then I want to give you my take on more of the hyperventilating based breathing that's popular right now, and my take on that. I would like to hear yours as well. So any thoughts on the neurology behind the breathing? I know we touched on it, but just the importance of that, so people begin to understand whatever dis-ease of the body they're in right now, is oftentimes digestive based or inflammatory based on the central nervous system, the autonomic nervous system, I should say.
If we are like, it comes back to what is often the cause of breathing pattern disorders, and chronic stress in adult can be very much part of that, excessive talking. And even when the stress is removed, the breathing pattern disorder continues. And breathing, we have to look at it again at those three dimensions. We have to look at it from biochemistry, biomechanics, and coherent. And too often, people are focusing on, say, improving the biomechanics, but they're not addressing nasal breathing. They're focusing on biomechanics, but they're not addressing biochemistry. Individuals who, for example, are focusing on heart rate variability and coherent breathing, they focus on slowing down their breathing rate to 6 breaths per minute, but they don't focus on the biomechanics, they don't focus on the nose, they don't focus on the biochemistry. I think there's a huge impact that, and people, if, maybe this does sound a little bit simple, but the only way to do it is just to put it into practice. There is a huge amount of research looking at heart rate variability biofeedback. And then we have to wonder, well, how can we improve that? Because HRV is the measurement, but the procedure to improving HRV is through the breath and nasal breathing and reduced breathing, because hypercapnia can also increase heart rate variability. And so many of our clients and instructors over the years wearing Oura rings, they report that their HRV is improved during sleep as a result of sustained nasal breathing. So we are able to tap into the autonomic nervous system. Now, one thing that we have neglected over the years as breathing instructors is we've neglected the role of hormones in changing breathing, and especially from the female perspective. Females are much more likely to have breathing pattern disorders than males, and especially during the monthly cycle. So when we're talking about day 10 to day 22, during the luteal phase post-ovulation, when there's an increase of progesterone, which is a respiratory stimulant, breathing can get faster and harder, and carbon dioxide levels can drop by as much as 25%. Now, here is the thing. If we have a female with dysfunctional breathing anyway, with a low Bolt score of 10 or 15 seconds, now when she goes into the luteal phase, she doesn't have much room for maneuver. She's already teetering on the brink of symptoms anyway, but the increased progesterone as a result of that stimulating breathing causing a loss of carbon dioxide, that in turn can bring on symptoms, increased pain. So hyperventilation, agitating the central nervous system, when the body is in a state of, the link between respiratory alkalosis and neuronal excitability, that pain perception is heightened and pain thresholds are lowered, but fatigue, panic, anxiety are also coming into play there. And it's inevitable. If you have somebody who is in pain, it's inevitable that they are going to breathe harder and faster. And that's putting the sympathetic nervous system into overdrive, which is feeding back into their pain. And, when unfortunately the research, because it's mainly dominated by men, neglected to really look at the influence, even though 50% of my clients over the years have been females. I neglected it until I started writing a new book and looking at the impact of hormonal changes on breathing. So I would say for females, just, even more importantly than probably men, is measure your Bolt score. Measure your Bolt score during different stages of the monthly cycle. And if you notice that your Bolt score is lowering and you've got increased pain during that time, start practicing slowing down your breathing, or at least be aware of how you're breathing. Is there a link between your fast upper chest breathing and your symptoms? Is it your symptoms that are causing your fast upper chest breathing, or is it your fast upper chest breathing feeding back into the symptoms?
And the Bohr score, just again for everybody, is the exhalation and then hold the breath for whatever it may be. And if it's less than the 25 seconds, that may show some form of dysfunctional based breathing. Is that correct?
Yes, it is. But it's holding the breath not for as long as possible, because if you hold it for as long as possible, it's influenced by determination.
Right.
It's literally having a normal breath in and out and holding the nose and just relaxing into the body, and time it in seconds until you feel the first definite desire to breathe. How long does it take for your body to tell you breathe? That's it.
Absolutely. And so now I want to get into some specific methods that we can use for improving overall breathing-based normal function. But before I do, I want to make sure so we can use the board score, the test there, but also looking at if you are tracking your biofeedback, because I know there's a lot of people in our community doing that. You're really looking at an HRV over 30 for an adult is just a minimum score that we're looking for there. We went through the specifics on the Dr. J. Wiles interview, which I can link up as well. We're looking at a respiratory rate of somewhere around 12 to 14, again, tracked on an Oura Ring or a similar device, and a resting heart rate below 60, most likely somewhere in the 40s or 50s overnight. And then when you're looking at your deep sleep, about an hour and a half or so, REM sleep, 2 hours or more. So those are the parameters that I look at as kind of my minimums. And then anything outside of that, I would say, okay. But again, that just like you said, those are data points. We're not trying to hack those. I don't really like that term. Now we're looking at, well, why would those be dysfunctional? Is it aerobic-based capacity? Is it mouth-based breathing? Is it poor adaptation to stress or exercise? So would you say there's any other parameters that you look at specifically besides the one that I just named, or if you have different values, if you'd like to mention those?
I'm very much a non-technological guy. Somebody comes into me, I look at their breathing, I observe the speed of it. I don't do any mental arithmetic. I get a feel for their breathing. Maybe that's the wrong thing to say because people are all scientifically based. I look at their breathing, get a sense, is it upper chest? Is it diaphragmatic? Is it slow? Is it fast? Is there a natural pause following exhalation? Is there effort involved by the individual? I measure their BOLT score. I have them practice the exercises. I see how do they react to the buildup of carbon dioxide. So I have them gently slow down their breathing to create air hunger. And air hunger not to the point of stress. And if I see that the person is reacting, if the air hunger is putting them very much into a fight or flight response, we know then that they have very much an increased chemosensitivity to carbon dioxide and may be more susceptible then to panic disorder and anxiety. So I take a slightly different route with them, just as individuals with chronic fatigue syndrome. So in some ways, for me, even though I've got a heart rate variability, I'm totally a novice with it. And most of the time it stays, well, here it is here, just to show you I have it. But unfortunately, it's in the box. And that's probably not where... and I've got the other one, M-Wave Pro. But, I think the science with heart rate variability has really led credence to the importance of slow breathing, nose breathing, diaphragmatic breathing, both during rest, sleep, and physical exercise. That there is a measurement there that, to measure the functioning of the autonomic nervous system, the balance between the sympathetic and parasympathetic. And I think it's tremendous, because we can tie in what we're doing then with the science, but I'm just not a technological guy. I only got a smartphone maybe 5 years ago, so that'll tell you where I'm at.
I don't think that's a bad thing at all, for sure, because what we're doing is we're using the knowledge that you're passing on, and also I believe you're the president of the Buteyko Professionals International, right? Is that the name of the organization?
Yes, the BPI. So we have a school in terms of its Buteyko Clinic International, and it would be the largest training school for Buteyko breathing in the world. And then I set up Oxygen Advantage because a lot of people coming into me with Buteyko were coming in and they were unwell, which was fine. But I remember giving courses on mindfulness and bringing in functional breathing, and 95% of the individuals coming in were all female. And I was thinking to myself, well, where are all the men between 20 and 40 and 50 years of age, especially men with high stress, high anxiety and depression? That's why we brought in Oxygen Advantage for the sport world, as well as men, especially alpha males, who, if you say mindfulness, they'll run a mile. So I have them come in and we use the same techniques, but tailored more geared towards sports and geared towards focus, concentration and performance-based.
Well, I mean, you have to package it correctly. I mean, that's part of the Western-based world, right? So nothing wrong with that at all. So we've actually, and you've mentioned a couple things that I use, and I've gotten tremendous benefit from them. And that's a nasal-based strip to open up my narrow nasal passages when I need to get in more oxygen or even sleeping overnight. The newer thing over the last couple of years is actually switching from the nasal-based strips to a silicone-based insert inside of the nasal passages to then open up the nasal passages from the inside out. There are pros and cons to that. The research hasn't been done, but I can tell you for sure, based on mouth-based devices like an Invisalign or something like that, any device that you put into your nose and presses up there begins to build up bacteria around it, and that bacteria can actually then go directly into the bloodstream. So I'm a little bit leery about those specific devices that go in the body rather than stay on the outside. I'd still much rather go with the old school nasal tape. But one thing that I've been doing, not yet at night yet, I will say that, is that I am someone that I work hard, I get my rest, but I work hard, and every day I want to make sure I'm well rested. So I have not done the mouth taping overnight. However, during the day, I have done mouth taping. I do speak a lot for a living, but it is nice to be able to shut that down and focus back. Now, I can very easily practice my nasal breathing without the mouth taping. However, the tape over the mouth brings me back to my breath. And so it's a nice reminder to say, back to your breath, relax, calm, breathe in, low, light, slow, and deep, as you say. Yes. So that's what I practice. But what I was looking for is that my daughters are actually, it's a really nice to see because they're very different. So they're different in physiological makeup and also psychological makeup. And again, it goes along with Ayurveda. My oldest daughter is more of that Vata-based body type. And she has a narrower palate, even though my wife, knowing what to eat, breastfed, all of those different things, till 2 years old, still has a narrower palate, not enough space for her teeth. Her teeth are coming in a little bit crooked. Now, that could be generational as well, right? I mean, there's a lot to that goes into this, and some of it can be genetic. There's many different factors that play into it. However, she's a mouth breather and always has been. And so I was saying to myself, and I wanted to ask you this question, my youngest daughter, not an issue. Wider palate, wider jaw, going to be more towards a kapha-based body type, and not as much of an issue. Wider nasal passages too. So when I look at it, I say, okay, one's mouth breathing because I go to and check on them before I go to bed every night. The other is mouth breathing, the other is nasal breathing. So for my older daughter, I don't want this to become compounded. She's already going to need something to be able to correct the teeth in her mouth. I don't want to do a palate expander because that can affect other parts of the jaw and nasal passage as well. However, what I'd like to do is something that we spoke about just briefly before this conversation, and I'm very fortunate that I'm having you on today, and that I'll be able to hopefully implement this with her because she is open to it. We speak about nasal breathing, and she's good about it. She really is. But when she's asleep, she's not thinking about it, right? The rest of her body takes over. She needs to get in more oxygen, so her mouth opens. So let's talk about a device that you've created that is, let's say, not necessarily safer, because the body will breathe, right? You put tape over your mouth, your body will find a way to breathe, or it'll wake you up. If you don't get enough oxygen, your body will wake you back up, kind of like a sleep apnea. So let's talk about the other device besides the nasal strip opener. What can we do to keep that mouth closed so that we make the nasal passages breathe how they were meant to overnight?
Sure. So with children, we first need to establish that the child can breathe comfortably through the nose. We need to find out, why do they have their mouth open? And typically when kids come into me, what we have with the parents, we have them wear tape during the sessions, and we have them do the nose and blocking exercise, which is simply take a normal breath in and out through your nose, pinch your nose, hold your nose, and walk around holding your breath. And all of the videos for children are free up on YouTube. Every single video for children that we teach at our clinic are already free. We've put them up on YouTube. Once we can establish the child can breathe through the nose during wakefulness, we have them wear tape, and the tape we have surrounds the mouth to bring the lips together, because we need some stimulation to change the behavior. And we have the child wear this for initially 30 minutes a day, up to as high as 90 minutes a day, when they're doing homework, when they're playing with toys, if they're on an iPhone, if they're watching TV, when they are distracted. At nighttime, depending on the age of the child, and with, obviously with the parents being comfortable with it, we have the children wear the tape around the mouth as well. Now, adults, we also have them wear the tape. And I'll show you the tape just in case people think, oh my God, he's saying to tape up children. That's not the case. The tape is called myotape, and it's developed specifically for myofunctional therapy. Myofunctional therapy is a therapy that's used in orthodontistry, and it's about changing the function of the tongue and the mouth in order to help ensure correct craniofacial growth. We know that mouth-breathing children typically develop crooked teeth because when the mouth is open, the tongue isn't able to rest in the roof of the mouth. And not only are the teeth crooked, but the jaws can be set back and the airway is compromised. So this tape here, it surrounds the mouth like this. And it's elasticated and it's cotton. And it's the tension created by the tape which is bringing the lips together. So the whole aspect of this is the sensory feedback. If a child is watching TV, and then if they forget about having their breathing through their nose, if they open their mouth, the tape will automatically remind them to breathe through the nose again, and during sleep then as well. And it removes the risk both for adults and for children too. So yeah, so we use that tape, and it's been very, very effective over there. And if you don't mind me mentioning the name of it,
no, not at all.
It's myotape.com as a means of helping to ensure nasal breathing during sleep. But what I would say to parents first, if you have a child with enlarged adenoids, then there is a risk that the child can have sleep disorder breathing. And you have to consider the problem is not just the enlarged adenoids, but the problem could be that the jaws are set back a little bit. There are some tremendous orthodontists in the United States, world leaders. Dr. William Hank, for example, out in Agoura Hills in California. The association, the AOMT, by Mark Moeller. There's Kevin Boyd in Chicago, a pediatric dentist. There's so many different, Dr. James Bronson, tens and tens of dentists that understand this. And the other thing I would say is, with children, if they have crooked teeth, the problem is not necessarily that the teeth are too big. The problem is that the jaw is too small. Mm-hmm. And I often use the example of the royal family. And if you Google Kate Middleton and Prince William and look at a couple when they are smiling and try and count how many teeth do you see. Kate Middleton has a really beautiful wide facial structure, and when she smiles, her teeth fills her mouth, and you will count about 11 or 12 teeth. You know that she's got that wide facial structure, plenty of room for the tongue and the roof of the mouth. The tongue is not likely to encroach into the airway. Prince William, narrow facial structure, and black triangles either side of the smile. So when you see black triangles, you know now that the jaws are too small for the mouth. And when the jaw is too small for the mouth, there's not enough room for the tongue. And the problem with the human face is it's changing and it's getting smaller. And the upper airway, we're talking about the space behind the nose, behind the mouth, the throat itself. A good airway is the size of a garden hose pipe. And many of us, me included, have the airway the size of a Bic biro. We are very much in that compromisation of being compromised in terms of sleep. And really, I would appeal to healthcare professionals, start looking and teaching children to breathe through the nose. This is being debated in the medical community since 1909. No child should ever have their mouth open. Because if we look even at a study by Karen Bonnock in Stratford-upon-Avon, looking at 11,000 children, mouth breathing is a contributory factor of sleep disorder breathing. Children with sleep disorder breathing, if untreated by age 8, had 40% increased risk of special education needs. So this is not fear factor or anything like that. This is just the reality of it. Children's brains are developing. They need deep sleep, and mouth breathing is impacting that.
Yeah, absolutely. And this is such a big part of it. So looking at children's food sensitivities, looking at environmental allergies, looking at gut health, anything that contributes to inflammation or that would block the nasal passages, we need to work on that. And then we need to work on the biomechanics, just like Patrick was explaining right there. So it's great to clean everything up, but then we also need to work on the biomechanics too. And if you can make the two function together, which I know people in our community can, I mean, run an at-home food sensitivity test, run a candida metabolic vitamins-based test, look at stool testing, whatever you need to say, okay, what's going on with the gut? And I think it's young. We don't need to test young kids for their hormones right away unless we really feel there's something off. But we can look at all the triggers for inflammation. And then it's simply looking at your child, looking at their mouth structure, their jaw structure, the nasal structure, and looking at them when they do sleep. Is their mouth open, jaw relaxed, hanging down, or is mouth closed, tongue up to that roof of the mouth? And we can look at that from a very young age. So I know what I'm going to do, since I was, again, hesitant to do the malt taping overnight, not because I'm worried, but simply because it's most likely going to disturb my sleep until I get used to it. So for me, I'm actually going to continue to use the malt tape during the day and actually try to use it a little bit on some of my runs as well, but to really focus on that chemosensitivity with CO2. But what I'm going to do is use the myo tape that you just spoke about as a prerequisite, because people who aren't watching this on video, when Patrick was speaking, he actually had the tape around his mouth. So you can open your mouth with the tape on. It just kind of triggers you, almost like kinesio tape, to close your mouth back up. And so that to me makes a lot of sense. Like my mouth, it would be harder to open my mouth, but I can easily do it. And then I'm going to close it back up, and then maybe I can get to the malt taping if I choose to down the road. So thank you for introducing that. I mean, it looks like an amazing product. What I'm going to do is send everybody back to today's podcast show notes page. I'm going to link up Bore score again. I'm going to talk about that, HRV, respiratory rate, resting heart rate, some of the other parameters with deep sleep. So if you are testing them, what those should be, they'll be right there. And then, of course, I'm going to link up the nasal strips, the myotape.com, Oxygen Advantage. Is there anything else that you would recommend as a place to get started for my community? And one other thing I'd like to ask too is, what is the future for Buteyko breathing, or what's the future for what you're going to be teaching? Meaning, like, what can we look forward to 2-3 years from now?
I think it's amazing where breathing has come. Back 20 years ago when I started, I often wondered, would I be able to continue teaching in this profession? And now it's really, really, the awareness has grown there. So a new book, for example, by James Nestor called Breath, that was launched about two months ago, has been a New York Times bestseller. It's really doing well in Europe as well. And it's a tremendous book on breathing. And that of course, has helped launch my work too, because even though much of what is discussed in the book is what we've been speaking about and speaking about my work, but as a journalist, James Nestor has approached it from an investigative point of view and really put a lovely book together. So I think the future is really, really bright. And I think it's great because it needed that. And 20 years, like as somebody says, well, it took you 20 years to be an overnight success.
That's right.
It was a long haul. And I suppose probably because it's difficult to commercialize nasal breathing, it's difficult to commercialize slow breathing, light breathing, deep breathing, and bringing it all together. So what I would say for people, we've put science up on our websites, oxygenadvantage.com, if you go to About and the Science, and look at the papers on functional breathing, functional movement, for example, lower back pain and dysfunctional breathing, nasal breathing during physical exercise, breath holding as a stressor, etc. So with Oxygen Advantage, we're looking at breathing from a functional perspective, but also as a stressor to force the body to make adaptations. And then with ButeykoClinic.com, that's where we work with children. The exercise for kids are all free anyway. And then we have programs for adults, obstructive sleep apnea. We have sleep programs. We've got anxiety programs. We've got breathing pros for asthma. So the two websites will be there, and, connect with us with social media. We try and put out the information out there. So yeah, I'm delighted. And it's podcasts like this as well, Dr. Cabral, because, being a lone kind of person putting it out there, and we need so much help because we don't have marketing, and we rely on, it's all word of mouth. And that's how it's happened. So, I'm grateful for it. My book, The Oxygen Advantage, has gone into 14 languages. I never thought that would ever happen. It's interesting. I just submitted a 140,000 word book yesterday to my book agent, Doug Abrams. And hopefully that one there will, it's going to do as well as The Oxygen Advantage.
Well, I mean, it's a testament to your work. And like you just said, it's 20 years to become an overnight success. That's typically how it works. But, better late than never with people finding out about your work. Since, I'm sure you'll be doing this for, many decades to come as well. So thank you so much for being on the show. I will link up all of your social media handles as well on the show notes page today. And for sure, when that new book comes out, I'd be happy to have you back on and we'll talk all about that as well. So thank you again. Your work is much appreciated and much needed during this time.
Thanks very much, Dr. Cabral. You're very knowledgeable about breathing.
Thank you. That means a lot coming from you. Take care. Are you ready to heal yourself and then go on to heal others? If so, the Integrative Health Practitioner Institute can help you discover proven functional medicine protocols that blend the best of 7 different healing disciplines from around the world. I personally share with you the exact handouts and protocols I use in my private practice that enable people to get well, lose the weight, and live longer, stronger. I want to pass this information on to the next generation of health coaches, and that is exactly why I created IHP. We are the future of the health coaching industry, and the skills and knowledge you will learn will make you an in-demand certified health coach anywhere in the world. Although we have many medical professionals taking the IHP certifications, no experience is necessary, and half our members have no previous health certifications. At the Integrative Health Practitioner Institute, our motto is a health coach in every home. Our goal is that you take this knowledge and then share it with family, friends, loved ones, your community, or in a practice where you create a career you love and can be proud of. The global IHP community is filled with some of the most kind and caring people in the world, and we can't wait to welcome you into our world soon. For more information or to set up a discovery call with one of our IHP Health Coach graduates, simply head over to integrativehealthpractitioner.org.